Hello, I'm David Lawrence. I'm Professor of Mental Health at Curtin University in Perth. I have been involved in child and adolescent mental health research for over 30 years. On behalf of the Australian Government, we are conducting one of the most important mental health related projects ever conducted in Australia. The Young Minds, Our Future survey is the third Australian child and adolescent survey of mental health and wellbeing. The survey has been conducted by Curtin University in partnership with the Queensland Centre for Mental Health Research at the University of Queensland and Roy Morgan. It is being funded by the Australian Government Department of Health, Disability and Ageing. Young Minds, Our Future will provide much needed data about how many children and adolescents experience mental health problems, what services they access, and how government can better support them and their families. The survey builds on two earlier surveys. The first survey was conducted in 1998, and the second survey, known as Young Minds Matter, was conducted 12 years ago. Together, these surveys have dramatically enhanced our understanding of child and adolescent mental health in Australia. The surveys have helped us better understand the impacts of emotional behavioural problems and how parents and families deal with these problems. The findings were used by governments and mental health stakeholders to develop better mental health services and to train doctors to better treat children and young people, like encouraging open and non-judgmental dialogue of mental well-being. The first survey found that mental health problems are common in children and adolescents. About 1 in 7 children had a mental health problem in the 12 months before the survey. At that time, very few children and their families with mental health problems received any help. This information started a wave of reform in mental health care in Australia. As a few examples, Headspace was started. The Australian Government started a training program to ensure that all GPs are trained in mental health. The government also started the Better Access program. This program provides subsidised access to psychology and counselling services under Medicare. By the time of the second survey, Young Minds Matter in 2013-2014, more children and their families were receiving help, but for many it wasn't until years after their problems had started, and many children were still not receiving an adequate level of care for their needs. The findings also highlighted the critical importance of better supporting children with common mental health issues like anxiety, depression, and ADHD in schools. Children and adolescents with mental health issues were on average 3 years behind their peers by year 9, a huge gap. This encouraged the government to invest in establishing the BU program through Beyond Blue. BU is an initiative to help all schools develop mental health and wellbeing strategies and programs. These examples show that these surveys can lead to real change. Young people today experience a host of challenges that didn't exist when the first and second surveys were conducted. As well as new technology, there have been massive changes in the job market and in education. Parents also face new challenges as they try to support their children to negotiate the challenges they face growing up. In order to help society plan how to best support our children, we need a detailed understanding of children's experiences in all parts of the country. While we know that there have been positive changes in mental health in Australia since the first survey was conducted in 1998, including new services and a reduction in community levels of stigma around mental health, we also know that there are many challenges facing the mental health system and many challenges facing our children and families. We know that there are parents who are struggling, parents who are worried about the well-being of their children and who are finding it difficult to access the services that they need. We need to tell their stories too. We want to hear the full range of stories, both good and bad. Australia's mental health system has definitely improved. However, we know that more reforms are still needed. The information that you provide will help shape the future for child and adolescent mental health in Australia.